My motivation for becoming a psychologist is because I want to work with populations like myself that don't have access to mental health care in the same way. So the Black community, for example, there's not a lot of psychologists that represent us. And in general, people feel more comfortable talking with someone that has their lived experience. They feel more comfortable talking with someone that knows what they're struggling with, can empathize what they're struggling with, and can feel heard by the person that they're sitting across from. One of the first things I did as a mental health advocate at my university was during the summer of 2020, back when the Black Lives Matter movement had really first picked up. And while the movement picked up, there was constant talk about Black mental health. First, about the just large stress that we had experienced from the George Floyd protests and incidents of police misconduct all across the nation. The collective conscious racial stress that we had experienced with that demanded more conversations about mental health. And then even more so, we recognized that there weren't a lot of other people like us that were available to listen to us and hear us and serve as mental health professionals. And so I took this context and went to my university and suggested that we really need more diverse counselors within our university counseling center. When I started, there were 0 Black counselors, and it was a big fight to get more counselors of diverse backgrounds in the counseling center. I talked with the director at the time, and she said, well, we tried to hire more Black counselors in the past, but they just weren't a good fit. And I felt that statement was disgusting in that it really showed the implicit bias that was in the hiring processes for mental health professionals at the university. So I kept fighting, I talked to more people, I talked to supervisors, and eventually through all these collaborative efforts and through the work of other students that worked with me, I was able to hire not just our first Black counselor, but our first 3 Black counselors. I believe we're up to about 4 or 5 now, along with multicultural mental health services, like services offered bilingually in Mandarin and in Spanish, as well as English. And the counseling center is a much more diverse place. And I feel that a lot of students truly understand how much that impacts them to see someone that looks like you and understands your experiences sitting right across the table from you. I know I really benefited from that. I think cultural competency is really important for 2 big reasons. One is empathy, understanding what the person in front of you is experiencing and knowing that it's a genuine struggle and having genuine ways to support them after the fact. And then also increasing their imaginative horizon. I think there's a lot of people that aspire to be doctors, to be health professionals in a variety of different ways, but it's a lot harder to imagine yourself as that professional if you don't have someone to look up to that's in that role. For example, if you've never seen a Black doctor before and you want to be a Black doctor, it's going to seem a lot less possible because you've never seen somebody that has actually gone through the process and has succeeded in becoming that person. That's how I was when I first started my mental health journey. I wanted to be a psychiatrist, but I had never met a Black psychiatrist before. It seemed antithetical because of how a lot of Black people talk about mental health and doctors in general being a very white-dominated field. It didn't seem like I really had a shot going towards that. Same thing towards the field of psychology in general. I didn't imagine myself as being a Black psychologist until I met my first Black grad student in a psychology program. And that relationship was really, really helpful for me, for allowing me to imagine myself as a professional, seeing myself in her shoes, the classes she was taking, the research that she was doing, the practicum hours she was putting in, the type of people she was working with. I saw myself as her more and more and more, and it just made my dreams seem like more of a reality. I saw that there was this gap, there was this need within our community, and that we were in desperate need of someone that looks like us, that's willing to listen and work with our unique struggles. I'm really thrilled to the opportunity to be a part of Nami NextGen because it gives me an opportunity to amplify a lot of voices within my community. People with lived experiences that may not feel confident sharing their stories, may not feel confident talking about what they need most and asking people to provide for those needs. I'm really passionate about that advocacy piece because I'm in a position where I can talk with all these incredible people and relay these concerns and also imagine myself as a future researcher and advocate through that work work by identifying what are the concerns that my generation, these young adults with lived experiences, need most, and how we can support them within the field. Nami makes me feel heard, it makes me feel understood, it makes me feel empowered. The community makes me feel empowered to pursue a career as a mental health professional, to advocate for policies that directly affect youth and young adults and their mental health, and to support people with lived experiences like myself so that we can all survive and thrive in this difficult world.